Welcome to my podcast. Today I'm going to talk about another common case can be faced in blood tube examination. So basically, after you introduce yourself, as we always agreed, double check the patient name and date of birth. So we're going to ask the patient, how can I help you today? So the patient might say that, oh, doctor, I'm having a terrible, terrible pain in my big toe or my joint or whatever. And he will say, or she will say, this is the worst ever been experienced pain. And this will just explain that the pain is really nasty and it's intolerable by all means. And if you sorted the pain for the patient, he will thank you for life because it's debilitating. So in that regard, you will ask the patient, can you tell me more about it? So the patient might say, oh, doctor, I was doing this and that, or maybe my back fall on my toe, and you might think that this can be caused by that heavy object was fall on his feet, essentially, but it's not like that. So the patient might say that this pain has just developed for the last 2 or 3 days. Maybe you need to ask him if he had any episode before then, and if it's the first time. So in that regard, you need to explore some of the risk factors. So I need to know the patient age, the patient weight, the patient diet, their lifestyle, any medication being used, and of course the lifestyle including any activity, and if the patient drink alcohol or beer. And in that regard, after the patient tell you about this horrible pain and the swelling involved and how misery he's feeling and how it's impacting and affecting his life and that he can't even sleep at night. So in this situation, usually it's extremely painful and it's monoarticular, basically. So, and the pain comes just, all of the sudden, and can be disabling and can reduce the quality of patient life. And so basically, the patient might say, all the pain has started 2 to 3 days or a week ago, might say this happened before. And you need to put in mind that those kind of things can be damaging if treatment has not established immediately. So you need to, as I say, explore risk factor. You need to ask the patient what diet do they do. Say, for instance, seafood and shellfish and sugary diet, all of that increase the risk. If the patient is drinking alcohol or drinking sugary smoothie or fluid, this can increase as well. You need to ask the patient their alcohol drinking habit, how much do they drink in a week, because it's known that the maximum allowed for both genders, basically 14 units per week. Also beers, it's related and linked to this condition. You need to assess the patient based body mass index because obesity is linked to this condition. Also, you need to know if the patient has high cholesterol or if he has any previous medical history that you should know of, like diabetes, insulin resistance, high blood pressure, and if there is any medication being used, if there is any other medical condition that you should know about, like for instance psoriasis is linked to this condition, and the medication used, like for instance ethanol, diuretic, aspirin in low doses, ACE inhibitor, lead, certain drugs like cytotoxic, and patient who has cancer. And basically, in those kind of condition, the urate or the uric acid will increase, and when it's increased, it will precipitate in the joint and the soft tissue, causing, like for instance, kidney stone, and can cause gout retrophy in soft tissue. And once that happens, it's a marker of a severe gout. And other comorbidity you need to think of, like metabolic syndrome and vascular disease, ischemic heart disease, all of that can be associated and linked in one way or another. So you need to bring to the patient attention about all of that. Then, after you have took the history, double check any previous medical history, any medication, any allergy, any family history. You need to examine the patient. Usually, it's the big toe, which is swollen massively and hot and tender, and the skin is red. So you will tell the patient about differential or your provisional diagnosis, and then you will take it from there. So you will make an agreement with the patient that we might send for certain blood test, but not at the acute stage, because basically the uric acid at that time will be normal. So you need to arrange for that after the conditions settle. And you need also to think about aspiration of the fluid to see the crystal precipitated. And you need to start the patient immediately and non-steroidal anti-inflammatory drugs, like for instance ibuprofen or naproxen. Naproxen is well known to cause a slight side effect and start action immediately. And you need to think about a nice guideline. The first line is colchicine. So you need to give that in the acute stage. For prophylaxis, it's always allopurinol, but that one should be given if there is like 2 to 3 episodes previously. Otherwise, you can start it. And if the patient did not respond to non-steroidal anti-inflammatory or had any side effect, like for instance history of peptic ulcer or bleeding, or not responding, so you think about steroid. So it can be given like pills or IM or sometimes intraarticular. Usually the medication gonna start within the first 2 days, so the patient will be happy and he will follow whatever you tell him, because basically the pain is intolerable. Also, you could advise about ice packing. So it's frozen pea can be wrapped in a towel, put over the inflamed joint, and ask the patient to raise the limb and have some rest until the episode settle. You need to bring to the patient attention about drinking water. So it's not less than 2 liters per day, and avoid caffeine, like for instance tea, but not coffee, because evidence shows that coffee can lower ureate level. So tea and cola, it's caffeine things to be avoided. Ask the patient not to put any pressure bandage on the joint, because it won't help, and tell the patient that treatment should be started immediately, otherwise further progression of the joint will cause damage and it can be disabling. Assess the patient body mass index and tell them if they are obese that they need to watch for a healthy weight and healthy diet. Also, if the patient is a smoker, you need to bring them to their attention that this is one of the risk factors, and also about the alcohol and the beer and the sugary drinks and the fatty food, shellfish and seafood. Encourage the patient to stay active, so they can do like brisk walking and try to be active rather than sitting and just thinking that the pain won't let them go. So you just need to be active gradually and keep it on. And then you will arrange for social care support if the patient is lonely and not able to help themselves, so day-to-day living and those kind of situations. If it's nothing works, you can refer them for a specialist who can deal with certain those kind of situation. The evidence also shown that fructose, which basically in the fruit juice, can be a risk factor as well. Also advise the patient about eating meat and liver and kidney. All of that can precipitate acute gout attack. Tell the patient that for the drinking of the milk, they can use the skimmed milk and the low-fat yogurt. And for the prophylaxis, as I mentioned, you need to start with allopurinol. If the patient is not responding, you can increase the dose from 100 once per day until you reach the maximum dose, which is 900 milligram per day, and see how it goes. If the patient cannot tolerate it, for instance, or the patient has any certain contraindication, like for instance ischemic heart disease, abnormal liver function test, cancer, ischemic heart disease, heart condition like heart failure, you can substitute with another drug called fucoxistate, which can be given instead of the allopurinol. You need to bring to the patient attention as well gout associated with premature death due to its linked to ischemic heart disease and metabolic syndrome, which is one of the comorbidity. So all of that you just need to explain to the patient and try to understand the patient point of view, and if you have any thoughts or ideas what might be the trigger for their condition and how to tackle it in an effective way in order to minimize acute attack and minimize further damage and progression of the disease. So by that, I hope that I covered all the points around gout episode and how to tackle it and treat it effectively and efficiently. Thank you.